Have you ever been jolted awake in the middle of the night by a sharp, stabbing pain shooting through your leg, leaving you gasping and clutching your muscle in agony? If so, you're definitely not alone. Night leg cramps after the age of 60 are surprisingly common, and for many people, they can feel like your muscles are suddenly twisting themselves into tight, painful knots that just won't let go. But what's actually going on here? Why do these cramps seem to strike more often as we get older, and why do they love to attack in the middle of the night? First, let's break it down. As we age, our muscles naturally lose some of their flexibility and strength. The fibers become less elastic, and the muscle tissue doesn't recover as quickly as it used to. That means our muscles are much more likely to spasm, especially at night when we're resting and not moving around as much. The lack of movement can make muscles more prone to tightening up. Dehydration is a big culprit too. As we get older, our sense of thirst can decrease, so we might not realize we're not drinking enough water. Even if you think you're drinking enough, your body might not be holding on to fluids the way it used to. Kidneys become less efficient, and medications can also play a role in how well your body manages hydration. Mineral imbalances are another key player in the cramp game. Our bodies need the right balance of minerals like magnesium, potassium, and calcium to keep muscles working smoothly. Low levels of any of these minerals can trigger those painful cramps. For example, not getting enough magnesium or potassium can make your muscles more excitable and prone to spasms. And as we age, our bodies sometimes have a harder time absorbing these nutrients from food, even if we're eating a healthy diet. Digestive changes and certain medications can interfere with absorption. That's why you might notice cramps even if your diet hasn't changed much over the years. It's not always about what you eat, but how your body processes it. Let's not forget about circulation. Sitting or lying in one position for too long, like during a long night's sleep or while watching TV, can slow down blood flow to your legs, making cramps more likely. Certain medications, like diuretics for high blood pressure, statins for cholesterol, or even some asthma drugs, can also mess with your mineral and fluid balance, increasing your risk of cramps. So if you've started new meds recently, or changed your dosage, that might be part of the puzzle. Always check with your doctor or pharmacist if you notice new symptoms. Another piece? Underlying health conditions. Diabetes, thyroid issues, nerve problems, and even circulation disorders can all increase your risk of leg cramps, especially at night. If you're noticing cramps more often, or they're especially severe, don't brush it off. Talk to your doctor. Sometimes frequent cramps can be a sign of something more serious that needs attention. So what can you do about it? The good news is, there are plenty of simple steps you can take to help prevent night leg cramps and get a better night's sleep. Try stretching your calves and feet gently before bed. Even a few minutes of light stretching can help keep your muscles loose and less likely to cramp up. Stay hydrated throughout the day. Make it a habit to sip water regularly, even if you don't feel thirsty, and keep a glass of water by your bedside at night. If you're not getting enough magnesium or potassium, consider adding foods like bananas, spinach, or nuts to your meals. These foods are rich in the minerals your muscles need to function properly. And if your medications might be causing trouble, ask your doctor if there are alternatives or if your dosages need adjusting. Never stop or change medication without professional advice. Sometimes a little movement before bed, like a short walk around the house or a few ankle circles while sitting on the edge of your bed, can keep those cramps at bay by improving circulation. And if one does hit in the middle of the night, flex your foot up toward your head, or massage the muscle gently until it relaxes. Applying a warm towel or heating pad can also help soothe the pain. Remember, night leg cramps after 60 are common, but they don't have to keep you up or ruin your sleep. With a few simple changes, you can take control and reduce how often they strike. Take simple steps to support your muscles, like regular stretching, staying hydrated, and eating a balanced diet. And always check with your healthcare provider if you're concerned or if cramps become frequent. Thanks for listening, and here's to a better night's sleep, cramp-free, sweet dreams, and take care of those legs.